Hello everyone, my name is Alexandra Verba. Today is January 3rd, 2021. Happy New Year's. So we have just finished the first 7 chapters of our anatomy book, and we are now on week 8, and we are taking a look at my favorite chapter, which was the skeletal system. I am hoping to eventually go into medicine in orthopedics, so the study of treatment of bones. So that is why I chose this section. Here is my little cheat sheet. Obviously, it's blank on that one side, and let's get started. So you do have a difference in the type of physicians that treat orthopedic or musculoskeletal problems. You have an orthopedist who does the clinical treatment and diagnostics of musculoskeletal problems. And then you have an orthopedic surgeon who, on top of being able to clinically diagnose and treat musculoskeletal problems, they can also perform surgery to treat those problems when needed. The organ I chose to take a look at is the femur. It is the longest and heaviest bone in the skeletal system. Like all bones, it does have a section of compact bone as well as a section of spongy bone. So that compact bone is going to be that really dense section that typically covers the outside coating, especially on that long section of the bone. And that compact section has very dense structure, but it is also where the canals form to allow blood vessels and nerves to enter into the bone. And then you have spongy bone, which is a much more open structure. As far as location of the femur, you're going to have, since typically you have two, it is going to be lateral to your mid-sagittal line in the lower half of the body. Your proximal articulation is going to be at the acetabulum, so that's that hip joint where it forms on your hip bone. It has the ilium, the ischium, and the pubis bone, and they form that acetabulum, and the head and neck of the femur join in there. Your distal articulation is going to be with the tibia, fibia, and patella. There are several large structures on the femur. As I just mentioned, you do have the head and the neck, which is that projection at the proximal portion of the bone, and that joins with the hip bones and the acetabulum. You also have your greater and lesser trochanter, which form attachment points for some very large muscles. And then you have your lateral and medial epicondyle and your lateral medial condyle, which form articulations for the ligaments of the knee joint. The femur, being a very large, very heavy bone, is a main producer of red blood cells in the body. And a fracture, whether it's closed or approximated or an open fracture of the femur, can actually cause a significant amount of blood loss in the human body. Since it is so vascular and it is so large and heavy, a fracture, an undiagnosed or untreated fracture in your femur can cause a liter or more of blood loss in an adult human body. So that's it. That is the organ I chose and the structure I chose. So I hope you all had a wonderful New Year, and we'll see you soon.